Dramatic new COVID numbers tonight, and this time it's good.
We don't get these updates as often as we used to. That may be a good thing. But when they come out, it's big news. And Seth Kaplan is live in the studio with details. Seth.
Yeah, Mike and Valerie, the updates went from daily to weekly and now just monthly. First, let's get the bad news out of the way. No ignoring it.
We've had almost 1 million Americans die from this disease,
including almost 45,000 here in PA. As recently as January, during the Omicron surge, hospitals were filling and people were dying. Now,
we've seen a sustained decrease since really mid-January. We've seen an even more dramatic decrease in severe disease.
UPMC infectious disease specialist Dr. John Goldman.
We at some point at the peak of our season in the 7-hospital UPMC system, we had 285 patients. Today, we have 8.
Almost all unvaccinated. The PA Department of Health says the Commonwealth saw an average of fewer than 800 new daily COVID cases in March, down from more than 3,000 as recently as February. On average, 32 Pennsylvanians died each day in March from COVID. That's down from an all-time peak one-day total of 242 just before Christmas of 2020. The CDC says only 3 PA counties have even medium transmission rates rather than low, part of a national map that hasn't looked this good in more than 2 years. So is the pandemic over? That's not Goldman's job to declare, but
we're in the process of making this a change from a pandemic to an endemic disease.
In other words, finally, more like the flu.
What I expect to see is each season we'll see a recurrence of COVID, but there'll be progressively fewer cases and progressively fewer hospitalizations.
And I asked Dr. Goldman, looking back now, what surprises even him as an expert in terms of the way the pandemic has evolved compared to what he expected 2 years ago? Valerie, he had some interesting answers to that, which we've posted at abc27.com.
Thank you, Seth.